Good afternoon. Welcome to the Crystal Dental Hygiene show. I'd like to welcome my three guests, Natalie, Hannon, and Jessica, future dental hygienists, and they're going to be presenting dental hygiene products important for your dental hygiene health. Hi, Natalie. Can you tell me what product you're going to be presenting to us today and the purpose of it?
Today I'm going to be talking about Pro Relief Paste, and its purpose is for dentin hypersensitivity. It's a desensitizer that contains arginine and calcium carbonate.
So what are some causes of dentin hypersensitivity?
Dentin hypersensitivity is a sensitivity with the dentin under your enamel, and it can be caused by gingival recession because of the exposure of the dentin. It can be caused by perio disease, erosion, attrition, etc.
And how does Pro Relief Paste work differently with other hypersensitivity products?
Pro Relief Paste, it has a unique ingredient, arginine, unique only to it, and calcium carbonate. Other sensitivity products, they contain potassium, which take a longer time to work on the teeth.
What products would you recommend for instant relief at home for hypersensitivity?
For home use, a popular product is the Colgate Pro Relief. That can be used daily as a toothpaste and paste, or there can be an in-office visit.
And how long should I expect for the Pro Relief Paste to last to prevent the hypersensitivity?
Pro Relief Paste, it usually lasts around 4 weeks compared to other potassium-based products that only last about 2 weeks and take about 2 weeks to work.
Okay. Thank you, Natalie.
Thank you.
And what about you? What product will you be presenting today?
So I'm gonna talk about Novamine Pro. It's a prophy paste. It's used in clinical setting. I'm gonna talk more about how it works.
So what is Novamine?
Novamine is a bioactive glass. It's composed of sodium, calcium, phosphorus, and silica. Originally, it was used as a bone regenerator for soldiers who were wounded in battles. But then, when they found out that these minerals are similar to those of teeth, they adapted it to dental applications.
And how does Novamine work?
So Novamine it's actually a product for people who suffer from hypersensitivity teeth. So as Natalie said previously, so when the dentin tubules are exposed, when you have gum recession or abrasion, so this exposure to like the environment, like the halter cold beverages or whatever you expose your teeth to, they react. So to treat this condition, Novamine occlude these dentin tubules by mineralizing them again to the previous form they were on.
So how will patients benefit from Novamine?
So it's not easy to find like over-the-counter products with Novamine in USA, but you'll definitely get the benefit in the clinical setting where you go to the dentist or the dental hygienist and they can apply the Novamine Pro paste on you. So it's basically applied during the polishing procedure. They apply the paste on the teeth to make sure it covers all the surfaces, and it actually has an immediate effect, so you can experiment the results right away. So when it's applied, you can test how the hypersensitivity is reduced right away.
Jessica, what product will you be presenting today?
I will be presenting Waterpick and Air Floss. Both are interdental products, and depending on consumers' preference, one does outperform the other one, and this is my goal to find out which one is a better product.
Jessica, what type of patient is the Waterpick catering to?
Because Waterpick is so easy to use, so general public, definitely general public will find Waterpick very useful. However, particularly, it's going to be really beneficial for patients with wide embrasures, as well as patients with dental work, including bridges, crown, implants, and braces. Waterpick comes with 5 or 6 different special tips, so patients can depend on their needs, switch on different type of tip, and clean around around your dental work.
Oh, wow. And what about the air floss?
Air floss, on the other hand, utilize air interspersed with tiny little bit of micro droplet of water and then delivered to interdental area.
And how does the air floss and the water pick, how do they compare?
It's very interesting. Many studies have proved that water pick is more effective than air floss. For an example, water pick removes 20 to 60% of more biofilm than air floss. In regards to gingivitis reduction, water picks can reduce gingivitis about 80% more than air floss.
Jessica, can you tell me how the water pick works?
Absolutely. Water pick delivers a pulsating stream of water and air. The combination of both actions force food debris out of your teeth and also helps to clean under your gum line. To help everybody understand how water pick works, I also brought a video to show.
Oh, great. We'll go ahead and watch the video and we'll be right back.
The Waterpick Water Flosser is the easy and more effective way to floss. Before using your new Aquarius water flosser, please read the Quick Start Guide and instruction manual. To get started, remove the reservoir from the base of the unit. Fill the reservoir with warm water and place it firmly back on the base. Next, select the tip that is right for you. Our orthodontic tip is perfect for cleaning around braces. Our plaque seeker tip is great for implants, crowns, bridges, and retainers. Our pickpocket tip gently delivers rinses below the gum line. And our classic jet tip is best for general use. Insert a tip firmly until it clicks into place. To remove or change the tip, slide the eject switch located on the side of the handle. To begin water flossing, place the tip in your mouth and lean over the sink. Press the power button to turn the unit on. In floss mode, start on the lowest pressure setting and increase to your liking. During use, you can stop the water flow by sliding the water switch to the off position. As you floss, close your lips enough to prevent splashing while still allowing water to flow from your mouth into the sink. To avoid mess, look into the sink while water flossing, not into the mirror. For best results, aim the tip at the gum line at a 90-degree angle. Starting with the back teeth, follow the gum line and pause briefly between teeth. A 1-minute timer with a 30-second pacer is included to ensure adequate water flossing time. The Aquarius has 2 modes. After flossing, you may select the massage mode for enhanced gum stimulation and circulation. All it takes is a minute a day to get healthier gums, brighter teeth, and fresher breath. For more information, visit waterpick.com.
Welcome back. Thank you for the video, Jessica. And you also brought the water pick with you today. So everyone will have the opportunity to play around, take a look at all the components and experiment with it. And everyone in the audience will also be able to have a pamphlet with all the information to take home with you. Thank you for watching.